Hey everyone! So, you're gearing up for the MPJE and you know the Controlled Substances Act can be, well, a bit of a beast. But don't you worry. Today, we are going to break down all 5 drug schedules in a way that's actually going to stick with you on exam day. Let's get right into it.
Okay, let's kick things off with a quick question. Just keep this one in the back of your mind as we go through everything. The answer is one of the most critical, high-yield facts you absolutely have to know for the exam. Trust me, they ask about this for a reason.
So, here's our game plan for today. We're going to start at the top with the most tightly controlled substances in Schedules 1 and 2. Then we'll work our way down to the moderate controls of 3 and 4, touch on the lowest control with Schedule V, and then wrap it all up with the most critical exam tips to really lock all this information in.
All right, Section 1, the heavy hitters. Schedules I and II. These represent the highest potential for abuse, and because of that, they come with the absolute strictest regulations. Getting these two straight is pretty much non-negotiable for passing the MPJ.
For Schedule I drugs, there's one phrase that says it all. No currently accepted medical use. That is the key differentiator. If a substance has no accepted medical purpose here in the US, it lands in this category. And what does that mean? It means it cannot be legally prescribed. Simple as that.
And when you look at the examples, it makes perfect sense, right? We're talking about heroin, LSD, MDMA. Now, I know there's a lot of debate about cannabis, but remember, for the MPJE, we have to focus on federal law. And under federal law, all of these have a high abuse potential with no recognized medical use. That makes them illegal to prescribe.
Okay, now for Schedule 2. The potential for abuse is still really high, just like with Schedule I. But, and this is the crucial difference, these drugs do have an accepted medical use. It just comes with some really severe restrictions. This category includes a lot of powerful and, frankly, necessary medications.
And you're going to recognize these immediately. We're talking about major opioid analgesics like oxycodone and fentanyl, and even stimulants like Adderall. These are vital therapies for sure, but their high potential for severe psychological or physical dependence means the rules for handling them are incredibly strict.
And there it is. That's the answer to our opening question, and honestly, it's the single most important rule you need for your exam. Schedule 2 prescriptions cannot be refilled. Zero. None. If a patient needs more, they need a brand new prescription every single time. This rule gets tested constantly, so burn it into your brain.
Okay, now we're moving into the middle tier, Schedules 3 and 4. I've subtitled this section with the most important rule for this group, because really, if you can just remember 5 refills in 6 months, you've already won half the battle for this whole category. So Schedule 3 marks a definite step down in abuse potential from Schedule 2. The key words to remember here are moderate to low. Yeah, there's still a risk of dependence, but it's considered less severe than what you'd see with Schedule 2 substances.
Some common examples here include buprenorphine for opioid dependence, you've got Tylenol with codeine, anabolic steroids, and ketamine. You can kind of see how these fit that moderate risk profile, right? They're clearly a step down from the major opioids we saw in Schedule 2.
Now let's slide over to Schedule 4. The definition here is super specific. It has a low potential for abuse relative to Schedule 3. The law makes it very clear that these substances are considered even safer and have a more limited risk of dependence.
And the examples really make this clear. This schedule is just dominated by the benzodiazepines, Xanax, Valium, Ativan, along with common sleep aids like Ambien and the analgesic Tramadol. You'll see these prescribed constantly. They're some of the most common medications out there.
Okay, pay really close attention here because this is a classic MPJ trap. The exam just loves to test the difference between Schedules 3 and 4. So remember, their abuse potentials are different. Schedule 3 is higher, but their refill rules, and this is the critical part, are exactly the same.
So let's just sear this into our memory. For any Schedule 3 or 4 drug, the absolute maximum number of refills is 5. And those refills, they're only good for 6 months from the date the prescription was actually written. After that, the prescription expires. So, one more time, 5 refills in 6 months. You got it? Good.
Okay, let's move on to our final category, Schedule V. As the title says, we are now at the very bottom of the ladder when it comes to abuse potential and, regulatory control. So the definition of a Schedule V substance really just highlights its super low potential for abuse and very limited risk of dependence. The regulations are the least strict of all, and get this, in some states, certain Schedule V products can even be dispensed without a prescription. Here you're going to find things like cough syrups that have small amounts of codeine, the anti-seizure and nerve pain medication pregabalin, and the anti-diarrheal Lomotil. These are all important medications, but their potential for abuse is considered the lowest among all the controlled substances.
All right, so we've covered all 5 schedules. Now let's boil this all down into the most critical, high-yield checklist for your exam. This is the stuff you absolutely, positively must focus on to get those points.
Here we go. Number 1, Schedule 2 rules are king. You have to know the no refills rule inside and out. 2, Schedule 1 drugs are not prescribable, period. And the story? And 3, and this is so vital for the MPJ, always remember that your state can have stricter laws than the federal CSA. Federal law is the floor, not the ceiling.
And let's just hammer this home one last time, because it is that important. The exam loves to test the distinction between Schedules 3 and 4. Just remember, their refill rules are identical, 5 refills in 6 months. The only key difference, at least for exam purposes, is their relative potential for abuse. Do not fall for that trap.
So let's end with this. These aren't just rules for an exam, right? They're the framework for safe pharmacy practice. So the real question is, how will you apply this knowledge not just to pass your boards, but to protect your patients and your license every single day of your career? Good luck with your studies. You've got this.